Are you curious about Gestalt language processing? You are not alone. Join me, Corinne Smoose, and speech therapy PD for our podcast, The Gestalt Get Together. Our episodes try to balance the enthusiasm and excitement about GLP and its associated intervention ideas, as well as a healthy dose of skepticism about how to understand and integrate this paradigm shift into your career and the field at large. We hope that you can get together with us to learn more about Gestalts.
Welcome to SLP Learning Series, a podcast series presented by SpeechTherapyPD.com. The SLP Learning Series explores various topics of speech-language pathology. Each season dives deeper into a topic with a different host and guests who are leaders in the field. Some topics include stuttering, AAC, sports concussion, teletherapy, ethics, and more. Each episode has an accompanying audio course on SpeechTherapyPD.com and is available for 0.1 ASHA CEUs. Now, come along with us as we look closer into the many topics of speech-language pathology.
Hello, everyone. Welcome. Thanks for joining us for our 5th episode. This episode is offered for 0.1 ASHA CEUs. I am your host, Dr. Treasyri Williams-Wood, speech-language pathologist and clinical research consultant. And here are the financial and non-financial disclosures. I am the host of this podcast, and I receive compensation from SpeechTherapyPD.com. And my private practice, Will Wood Consulting Service in Chicago. I am the CEO of that, and so I collect a salary. I also collect a salary from Lingraphica, Inc. My non-financial disclosures are that I serve as member at large in speech-language pathology on the American Speech and Hearing Association ASHA Board of Directors. And now, here is a little bit about our guest today. Dr. Megan-Brette Hamilton is the Chief Staff Officer for Multicultural Affairs at ASHA, and she has been a ASHA certified speech-language pathologist for over 20 years. In her current role, she oversees ASHA's Office of Multicultural Affairs, ASHA Professional Development, and the Continuing Education and Convention and meeting teams. So we already know we have a class A overachiever on our hands with a superwoman cape. And so I'm just so excited not to be toiling alone because I'm a recovering superwoman. Previously, she worked as a qualitative researcher and academic professor where she taught courses on child and adolescent language disorders, clinical problem solving, and communication disorders in society. Dr. Hamilton also worked 10 years as a school-based clinician, working collaboratively with families and other professionals in New York City K-12 schools. She has published, presented, and trained on the topics of African American English, culturally responsive practices, and effective communication across a variety of settings and audiences. Dr. Hamilton sits on the advisory boards for the Maryland Initiative for Literacy Equity and the National AI Institute for Exceptional Education. She is the former host and producer of the Honeybee Connection podcast by MB and owner of www.meganbrettehamilton.com. So please join me in welcoming our esteemed guests for this evening, Dr. Megan-Brette Hamilton. Welcome. And I just love your fall moment that you have going on right now. Thank you so much for being here. And I am really excited to have you here just because of the bio I just read and your background and being in so many different settings. And I think that our discussion tonight is almost a testament to the power of good mentorship, wouldn't you say?
Agreed. Yes, I would agree with that.
I think one of the cool things that people may not know about you is that you are also a product of the STEP mentoring program, correct?
I'm a product of the Minority Student Leadership Program,
The
class
minority
of
student leader.
2001. Some people hear it as MSLP, but yes. And I also was a STEP mentor. So when it comes to STEP, I was not a mentee, but I was a STEP mentor. So it is interesting that it's very meta. It does feel very meta. You are correct.
Right, just coming back around. So I think you're the perfect person that we can have speaking to this topic tonight. And my first question for you is, how, in your opinion, can mentorship in speech language pathology foster cultural humility? You know, when people say mentorship and cultural humility, those two things don't necessarily go together. Usually people think cultural competence in practice, cultural competence in research, but we don't think about mentorship. So how can we contribute to more inclusive communication practices in speech pathology through mentorship?
A lot of ways. So you said I was doing a lot of thinking and I just did a lot of brain dumping. So I'm going to hit on a few things and then you stop me and then let's talk. One of the first things that came to my mind when I thought about this question was the assumptions people make. I think a lot of times mentors can make assumptions about their mentee, about what their mentee needs, about what their mentee wants. I also think vice versa. Mentees can make assumptions about what their mentors can give them and what they need and what they want. So I think there's a lot of assumptions that can be broken down if questions are asked and assumptions not made. I think there's a lot to do with establishing trust in that mentorship relationship. And something I want to set the foundation for is there's so many different ways mentorship can look too. Just two of the ones that came to my head where there could be a very structured mentorship, right? As in, this is the mentor, this is the mentee, we're putting you together and here you go forward with your relationship. There's also organic mentor-mentee relationships. Like you just find someone, there's a gravitational pull, there's something that happened, there's a reason you all connect. And so I think, I think those kinds of relationships, the foundation makes that progress different. So I think it's important to understand not all mentorship relationships are going to look the same, right? So regardless of that, though, I think assumptions made need to be broken down. I think establishing trust. There's something that's really interesting that I think about when there's a partnership of any kind. And so right now we happen to be talking about mentors and mentees. There are many diversity dimensions that people carry with them. Some are very salient, even though we can still make assumptions on that, perhaps race, perhaps gender, and some are not salient. And I think sometimes we forget when we're in this relationship what identities are veering to the top in certain situations, in certain interactions. And again, I get back to the assumptions can be made. You and I can be talking and we might think we're bonding about being both Black women, but in reality, there is another identity of mine. Perhaps mother is raising to the top right now. Perhaps, daughter is raising high right now. So maybe another dimension is raising high. So I think when it comes to mentorships, people have to be very honest, open about what is it that I need from you? What is it that you can give me? What is it that I can give you? And not make assumptions about, oh, this is going to be a great relationship because we're both fill in the blank.
I love that. And I'm curious as you're saying this, and I would love for folks to throw this in the chat. If you feel like you can identify whether you have a formal mentor in your life or have had a formal mentorship experience in your life, or have you kind of had just a mentor relationship that has developed organically. And I'm so interested to hear and see how that breaks down, because I think that's such a good point, especially when we're young and in our formative stages of our career and our development and undergrad and graduate and our initial work in this profession. Sometimes we don't even think about intentionality with our self-actualization process. You know what I mean? I know when I was a student, I didn't even know what I needed from myself, much less what I needed from another person. All I knew was I see someone, I admire them a lot. there's something here that really draws me to them. And I would love it if they could be my mentor, or sometimes I didn't even have the words for it. I just wanted them to be in my life. So,
Mhm.
I think that's such an interesting point when you talk about how we have to be very intentional in considering how we are seeking what roles we're seeking our mentors to fill. And I wonder for you, do you have any examples of mentors that have successfully kind of integrated cultural humility into your relationship? And how did that end up impacting your clinical practice today?
Yes. So you hit on another point, which I think is important. I think it is best practice, and we'll put that in a weird quote right now, to not just have one mentor, to have mentors, right? You said the plural, because I don't think there's going to be one person who will help guide you to wherever it is you're trying to go, whatever this is you're trying to go. There won't be one person. There will be multiple people in your lives, multiple mentors. One of my favorite mentors that I can talk about right now, she actually was my dissertation supervisor. You know her.
Who is she?
Yes. Okay. So I'm with Dr. Laura DeThorne, and we were not that far apart in age. So when I got I worked on my dissertation, I was actually I went at the age of 37. So I was a little bit older working on my dissertation. So she ended up being my supervisor, my dissertation supervisor, and I worked with her for 4 years. She identifies as a white woman, and the cultural humility that we both, one, it helped that she just kind of has this innateness to seeing different perspectives. She does. There's an innateness for her to see different perspectives. And for myself, that's kind of how we bonded. We're both able to be like, well, that's how I think, but I'm not sure that's how someone else thinks. We both have this strong empathy about us. But there are things that we had to work through. There are things like understanding what jokes were funny. I remember how I used to think your mama jokes, still do think they're hilarious. And we got into a really deep conversation about the humor behind your mama jokes, because she did not see that humor. We have a different background. We have different background experiences, right?
Yeah.
We had different communication styles even. And I think for us, we both just had to work at having those conversations, realizing when discomfort happened, realizing that tone might have played a role in our communication differences, that language, that background. Being open, though, to having that conversation is what we had to do, because we're both great people. We got along really well, but there were times when we had to take a step back and say, okay, I felt some kind of way about that.
Oh, and so what specific role did your mentor play in kind of promoting that psychological safety? Because I think that a lot of folks, myself included, I think, the last person that you ever want to disappoint or put in a position to feel uncomfortable, even by expressing your discomfort when it comes to, things that are related to culture, is someone you look up to, right? Especially because a mentor, I think, is pretty hard to find. And there's always a chance, just like with any relationship, that the person could say, okay, I'm just going to terminate this relationship. I'm going to put space. And so what do you think about, this relationship made it psychologically safe for both of you to kind of say, hey, it's getting kind of uncomfortable here. Let's chat.
I do think the trust was established pretty early on.
Okay.
I trusted her. I trusted that she wanted the best for me, right? I knew that her actions, the behavior, the words, all of that made me realize that, okay, she wants the best for me. She has my back. I know that. But I also think there is something that comes from being sincere and curious, right? So I often talk to people about when they ask questions, especially the younger generations. Oh, I feel like an old woman now. When asking questions, are they inquisitive? Or are they interrogating? Because I think sometimes people will ask questions in a way that come across, and this is the cultural context matters. I know that, right? Sometimes people may ask a question and one person perceives it this way, one person perceives it that way. I'm very well aware of that as well. But I think the questions that we would ask would come out as inquisitive, curious, with sincerity. Like, I really want to understand why you felt that way. I really want to understand why you think we should word it this way,
Right.
especially working through a dissertation.
Exactly. And just, I think what I'm interested to hear is that what do you think the speech language pathologist's role or charge is in terms of the call for mentorship? Do you think it's something that's optional? Do you think it's something that we are called to do? Or do you think it's something that, depends on the circumstance? What do you think about that?
Okay, do you know me at all, Treasure? My whole world is dependent.
This is a
My whole
setup.
world is
This is a setup.
okay? Some people don't. I am perfectly fine living in gray. Um, I think it depends. I think, and I don't say this sentence to be disrespectful or rude or anything. I think you need to know who you are. I don't know if everyone should be a mentor, right? I don't know if you have it in you as far as providing time, right? Providing advice. Maybe you're going through your own stuff, and right now you need to focus on yourself. But I do think if you have the time, the desire, the wherewithal, someone knocking on your door, hey, 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 I admire you. There's something about this energy that I want to emulate. Then I do think that's something to look at and say, okay, what can I do? What can I get this person? Sometimes I think we think mentoring, again, I go back to this formal versus kind of organic, has to be this very formal thing. Sometimes just sitting down and talking to someone about your own life journey, it will do something to them. It will be like, wow, I thank you. And you're like, wait, what did I say? You're like, you basically just said your journey, and I needed to hear that. So sometimes I think people, SLPs, can look at mentorship not necessarily in a one-dimensional way, right? It can look a lot of different ways. It could look like a one-time thing. It could look like a longitudinal thing, right? It can look different ways. So yes, at some point, if someone's looking towards you, looking at you, wants to be where you are, then I would say I think you could owe it to them to at least have a conversation, even if it's just a one-time conversation.
Okay. So I love this because it makes me what I think about is our profession, right? And the reason I asked you that question is because we are in this, from a professional, standpoint in terms of the trajectory of where our profession is going. We have this huge need of speech language pathologists, right? And we have all of these students coming through our speech language pathology programs, and it's very difficult for them to find placements. It's very difficult for them to find externships. And then even when they do graduate, they then, complete their clinical fellowship experience, and they have a clinical fellowship mentor. And so our profession, right, the access to our profession is really designed. I look at it like Super Mario, like every time, like basically like jumping through these hoops that our mentorship kind of designed, right? At every stage during our matriculation into this profession, somebody's got to be willing to raise their hand, knowingly or unknowingly, and say, I am going to have that level of emotional vulnerability, and I am going to try to give back. I have heard, this year, a lot of really interesting feedback from folks who are in mentorship relationships that have kind of gone wrong on
Oh,
both
okay.
ends. And so I've heard things from the mentees where they felt that culturally, well, we're Gen Z and we have a different culture, or I am of this culture and this race, and my mentor is of this culture, this generation, this race. And I really did not feel seen or, heard from them. And it's a painful kind of meeting point for both, because when people do mentor, they are kind of opening themselves up and investing a lot of emotional labor. It's not just the time and productivity loss, it's a lot of emotional labor. So I just wonder, when we're looking at teaching folks how to be culturally responsive in their clinical practices, do you see any similarities to that culturally responsive practice and cultural competency, right? And mentorship being culturally responsive in the mentorship relationship.
Definitely. And I also want to hold on to a point that you made that I don't want to lose. Robin Jarrett. I'm just going to remember Robin Jarrett. I completely agree with you because I tell people all the time, we are a profession that works with people. People. We always will work with people. That is just what we do. And if you work with people, people come in all different dimensions and identities. And if we work with people, whether they are client, patient, or student, or they're our mentee or graduate student or anything, we have to be able to see them through their different identities, their different perspectives, their different backgrounds, their different cultural anything. I think that is key for us to be effective at what we do, not only in the clinic, but also, like you're saying, in the mentorship. And I think what's most important about that is to understand that those layers, those dimensions of diversity, those identities in the mentorship, those matter just as much as they matter in the client-patient-student relationship. They matter because if you want to actually be successful, whatever that looks like in a mentor-mentorship relationship, right? Because I'm sure success looks different to everyone, but whatever that success looks like, you're going to have to recognize that, okay, we've got some differences, we've got some similarities, and we need to make sure that we work through these if we want to have this kind of relationship where you are getting what you feel like you need and I am getting what I feel like I can provide. So I completely, yes, I think there can't be a place where we don't have cultural humility in anything we do. You know, there's always that reflection that we need to be thinking about. Why did I think that? Why did I say it that way?
Yeah,
Why
that's
did all of a sudden she
self-reflection.
opened her mouth and I just felt this way? That's interesting. I wonder where that came from. I mean,
Yeah.
that's that self-reflection that really should never go away. Just
Right.
in general, you know, question why you think something. I always tell people you can have an opinion all day long. Isn't an examined opinion? Did you take a look at
Oh, I
why
like that. That might be a
have
golden
that?
nugget. You can have an opinion. There's a difference. What's the difference between an opinion and an examined opinion?
Opinion to me is, one example could be, it's a regurgitated sentence, right? You've heard someone say it, you've heard it
Sounded
before over
good.
and again. There's an echo chamber of some sort. I don't like using these words, but it's true. But you've heard it, you repeat it, right? And you might own it as your opinion, but have you examined it? Have you taken that thought apart and say, well, why do I think that? Why do I think people like such and such are this way? Why do I think that people who speak this way come from this background? What? Okay.
Yeah.
No, that is the examined
I
opinion.
love it. Oh, that's a gold nugget I'm taking. So in your opinion, do you want to go back to Robin Jarrett?
Jarrett. Sorry, yes. So what you were saying triggered something in me. So in a good way. I also think, you know, we have this, not everyone and not all the time, but sometimes, you know, you find a mentor and there are some similarities between the two of you, which is why you think this might be a good mentorship.
Yeah.
And it could be, again, any kind of cultural background or identity, but it could also be our profession. You're an SLP in this setting. I want to be an SLP in this setting. Let's do this. Let's match. I think, again, what's important is to understand what it is you want out of this. What are you trying to, do you need advice? Do you need guidance? Do you need assistance? Because that mentor may not even be in the field. That mentor could be outside the field and have had something else that is important to you. So my example was when I was also getting my PhD at the University of Illinois, there was a woman, a full professor, African-American woman, who was in sociology. And I happened to work in her lab for like 2 years. I learned a ton from her about qualitative research. We don't do too much qualitative research in our field. It was going to be hard to find mentorship. And granted, Laura the Thorn was doing amazing work with me too, but to work in the lab of a full professor at University of Illinois, the implicit mentorship that I got from her was something that I wasn't going to get from my home department.
Right.
So
Yeah.
I think it's important to sometimes think, what is the goal? Is it that I want this really specific setting? And so I'm looking for, you know, with networking, that's different. Okay. But if you're looking, how do I set a goal find the right steps, achieve it, email these different, people, whatever, then you may not necessarily need someone in the field, right? That could be something for someone else or
That's
for another area
good.
of mentorship you're looking for.
I never thought about that, but as I reflect, my area is really adult neuro, right? So dementia and Parkinson's and, cognition, communication, swallowing, aphasia. But my top mentors are not in that area at all. Dr. Yvette Hyder, who has been someone who has known me for 15 years, probably, and mentored me and just raised me at Western Michigan University. Her area is in childhood trauma and language. And that relationship has been so so impactful in my life, but it's never been because she was in adult neuro, right? And so
Yeah.
I think that's really, really interesting. I never thought about that before. And so you kind of actually answered part of my next question, but I think I want to go deeper here. What challenges do mentors face when trying to incorporate cultural humility into their mentorship practices? And so I think one thing that you mentioned that I said, I think you partially answered it, was that thinking that just because the sameness means compatibility, or the sameness means that, we don't have to do that extra work, over kind of almost over the over reliance on those basic same things. I think that's a challenge, but I'm interested in hearing what other challenges, would you say, like the top 3 challenges that mentors tend to face when they're trying to incorporate cultural humility into their mentorship practices?
So opposite of the sameness. So let's say it is like a cross-cultural mentorship, right? Then knowing what you can bring to the table. You will probably not be able to bring everything that mentee needs to the table, right? One example, and this is a true example that happened at university I used to work at, there were professors who were looking to mentor students of color, and these professors were not of color, and they were, hoping to mentor them, and that could have worked and wonderfully, and that's wonderful. But I remember one of the students was asking about how do they word it? What was the right hairstyle they were allowed to wear during clinic?
Yeah.
And that was really difficult for a mentor to answer. That was not of the same background, same hair type, same something, right? And you don't need everything to be the same. But I remember saying, like, yeah, that is something, if you don't feel comfortable answering that, that might not be in your lane, but you can help them with other things. So
Yeah.
recognizing where you can mentor, where you can help, but also being humble enough to say,
That's
I
not
don't know.
that's
I
not
don't know
my
if I can
strength.
do
Let
that.
me,
Yes,
let me
exactly.
connect you.
Yes,
That's such a good
yes,
one. Okay, because,
yeah.
and this makes me think of this anecdote. It literally just popped up in my mind. So
Mhm.
I'm a alum of Western Michigan University, and another mentor of mine who was really instrumental in me getting into aphasia was Dr. Sandra Glista. And I remember that, we would have all these talks because I was so into aphasia and so into, bilingualism and naming. And, I was really interested in kind of the bilingualness of it because I was also studying French. And I remember that we were at a conference and she saw me. It was a series that they were doing at the school. And she said, you know what? I forgot this. I can't even remember who the person was. This person, you asked me this question about African American French or something like that. I don't, I'm going to introduce you to this Black speech pathologist who's in here, here, and here, because you need a Black person to have these kinds of conversations with. And I know that I can only take you so far. And I remember at the time, I was just like, oh, okay. And she was just so matter of fact about it. If anyone knows Dr. Sandy Glista, she was like, you need a Black woman for this. Come on. And she just grabbed my hand and walked me over to the room. And it was like, you there, Black woman, this is my student. And it was, and at the time because I, was really young, I don't think I appreciated her being humble enough to yield
Oh,
her
that's hard.
privilege, right? And be like, you know what? I know what I can bring, but I also want to make sure that I am a connector and putting you in the path of people who may be able to add colors to your palette. So when you do paint, your picture is more vibrant. And so I love that.
Mhm.
What other challenges?
Well, I also want to say too, that is not to say that they shouldn't continue to work on their cultural humility, right? I always
Right.
tell people addition is not subtraction. Just because I said one thing doesn't mean it erases something else, right?
That's great.
So I think just that discomfort, challenge of working through the discomfort of addressing their own biases,
Yeah.
right? Like that is, it's not comfortable realizing that you might have certain perceptions, preconceived notions about things and people. And oftentimes when you are working closely with someone in a relationship, as you said, that where your emotional vulnerabilities are there, and someone calls you out, calls you
Right.
in, that is not easy to have that discomfort. And sometimes you have to sit with it, and sometimes you have to then address it. And that I think is something that people should, I think that's a challenge to work through, especially because as a mentor, there's this power dynamic, right? And that's another balance you have to face. So there's this power dynamic, there's these preconceived notions that might happen that you didn't know would happen. And so now here comes this, young something, I was gonna say whippersnapper for like my parents.
I was
This
thinking that.
young,
I was-
this young person who is, trying to, gain information from you, learn from you, admires you. And then they're like, wait, hold up. Wait, what was that part you just said? Yeah, that was actually, and to sit with that and to be able to hold that discomfort is a challenge, right? And to be able to recognize that I really don't know this, and I didn't know this. It's hard to not know what you don't know. So I think the power dynamic, that I think I said this earlier, the assumptions, and just when to recognize, again, not just that this may not be your wheelhouse, but when to recognize that you need to start asking different questions.
That's a good one. You know, something that you just said that just resonated with me. As a mentor, and I've been a mentor cross-cultural, cross-gender, just all different types of identities. And I have had to check myself and call myself in because I realize this now as you're saying this is because sometimes as mentors, we think that we are entitled to be free from discomfort
Mhm.
because of the power dynamic. We are giving, we are pouring in. So how dare I have to be uncomfortable or inconvenienced in any way? I am trying to help you. I am trying to shape you. I am trying to pour into you. So when a person, our mentee,
Mhm.
calls us in and may say, well, for me, that meant block, blank, 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 or for me, that meant this, or that really activated something in me that I really don't like, and I'd like to talk through that with you. Sometimes we can get in our own kind of egos and go, well, so-and-so's mad. I don't even have to do this, and kind of put up that wall because there's this notion that that by signing up to be a mentor, we're doing a service to someone else, and we are thus entitled to be free from any type of discomfort. And that is not necessarily true. And I'm thinking of certain students that I've had and mentees that I've had that I am so blessed that I have either said things or they've questioned things or had experiences when we were talking and they said, no, Dr. Williams, well, I don't think that, or Dr. Williams, Wood, that hurt my feelings. And I stopped and I thought, I'm out here with you at 7 o'clock at night and you talking about I hurt your, but you have to, you know what I mean? But you have to stop and go, well, just because I'm your mentor does not mean you don't have the right to challenge
Exactly.
problematic behaviors.
Yeah.
And I have to I have to grow up and be able to reflect on that, right?
I completely agree. And just because that happened, whatever that was, whatever the situation was, doesn't make you less of a mentor, doesn't make you less of what they need, right? I think to recognize that too, like, okay, wow, I just stepped in that. That was awful. I am so sorry.
Mhm.
But to still realize that I can still give you some things you need. Because I think sometimes we do take that ego hit and then you start to think like, oh, okay, so maybe I'm not that good of a
I
mentor,
don't
or
have to
maybe
do
I
this.
don't do
I'm
what I,
too
yeah,
busy. Yeah.
yes. But no, I think all of that, accepting it, and it's not easy. We all know that it's not easy when someone calls you in or calls you out. But to accept that and to move from that is a big deal.
Yeah, and the humility of being able to know that when you step into a mentor situation, it is just as much for your development, I think, as for others. That's a good. So, how else, we talked about self-reflection. We
Mhm.
talked about having an openness to feeling uncomfortable or having those tough conversations. We talked about intentionality. How else can mentors overcome biases or preconceived notions during the mentorship process?
I think I wrote notes down too. I think one of the things, so abstractly, I'll go very abstractly first. Being willing to unlearn things as well as learn. I think that's important. I think the distinction between unlearning and learning is really important. Listening, reflecting, being curious, being sincere, those are all very kind of abstract feelings, but I do think those are really important. Other things are check-ins, something a little more tangible, right? Just checking in. So if it's, again, a longitudinal kind of relationship, and this is going to be for, either a year, like a very structured mentorship program, or it's going to be just for who knows how long, because that's the organic nature of this relationship. Check in, like, how are we? Are we okay? Are we good? Like with any relationship, you check in, and
Yeah.
maybe that check-in looks like asking certain questions. Maybe that check-in looks like a reflection period. I think there could be even more structured things like, you know what? Let's talk about, I don't know, think of a topic, a subject. What are your values and beliefs around that? Ooh,
Ooh,
interesting.
you
I
just
didn't know
jump right
that.
into
Yeah,
it.
like what are your values and beliefs around that? Okay, that's interesting. I know. So it could be, again, very structured, very straightforward, or it could be organic. Something comes up, something that makes people, so one of them, mentor mentee feel uncomfortable. And then that's the conversation you have. Okay, so interesting. Holidays. I didn't even know that this was a holiday. Okay,
Yeah.
so talk to me about that. Talk to me about the background. I didn't even know. Okay, well, we celebrate this, and the reason we celebrate. Okay, got it. Right, like actual.
Initiating that
Yes,
curiosity.
yes.
I love
And
that.
so those were, those are some of the ones I thought. I was like, you check in, you ask the questions, you ask the hard questions, and again, just it could be a very upfront establishment, so that everyone. I always talk to people about aligning their thought bubbles. If someone comes to you and is like, I don't know if they would even say, like, I want you to be my mentor. Let's say that
Right.
happens. What does that look like to you?
Mm-hmm.
Because our thought bubbles might be really different, right? So for
Right.
me, you say mentor, and in my head, I'm like, oh, okay, I'll just be able to meet with them maybe once every couple of months, and then I'll check in. Okay, I can be a mentor. And then this, student or whoever, young SLP, they're thinking, okay, I'm going to talk to them every Thursday night, and they're
Yeah.
going to talk an hour, and I'm going to get through all my, and I'm going to, yes, someone's going to help me get through my career. So
Yeah.
establishing upfront, okay, so what does that look like to you? What does
Yeah.
me being your mentor look like to you? Right? Even I try and get on people the same thought bubble, even with like words like engagement. I just wish you would just, during a check-in, someone's like, I'm okay, but I just wish, I guess you were a little bit more engaged. What does that look like
What
to
does
you?
that mean? Yeah. Does that mean
Tell
I'm
me what that looks
listening
like
more?
to
Does
you.
that mean I'm asking you more
Right,
questions?
right.
Yeah. That's
So
a good
just
point.
aligning thought bubbles, making sure you're all on the same page when we're having this relationship, because a lot of assumptions can get made in a relationship. And even if you start off one way, time goes on, context changes, relationships change, life
Right, because
happens.
life
Let's
does
check
not stop
in.
happening,
Let's
and I
check
think
in.
that's really challenging too, because I think I call it the disease to please, right?
Yeah, that one.
Right? No, the Dr. Megan-Brette is my mentor. Oh, she seems so busy. We've always met kind of right here, but I kind of need more. But I don't know if I ask for more, will I get rejected? And so it's a good point of checking in and as a mentor, being able to, you know, again, align your thought bubble and say, hey, I know I'm going through a lot of things and we haven't talked in a while. is this working for you? What kind of is this helpful to you, or, you know,
Do you need something else? Do you need something else? And is that something else something I can give?
yeah. Yeah, I love that. And so I think that I'm gonna just throw a random wild card question in here about the MSLP program because it's been a really successful program. It's how long has this program?
This year, it makes 25 years.
25 years. So the Minority Student Leadership Program, wow, has been going for 25 years. And a lot of the tenets are rooted in cultural humility and
Mhm.
cultural responsive mentorship. So I would just love if you could tell us what are some things that you think that the MSLP program is getting right in terms of mentorship that we could all take a note from.
So thank you for asking that question. What's been really interesting is, Vicki Deal Williams and Melanie Johnson were the people who were running this program for, I believe, the past 25 years. I know it was established by, oh goodness, I want to say Pat Cole. I think it was her idea, but Vicki Deal Williams and Melanie Johnson are the names you hear with MSLP. So what was interesting is I was a student in the program and I lived it, I experienced it. It was awesome. I lived my life. This is what I did. Now I took over where Vicki left off. And so what's been interesting to me is to take another look at it, right? Not from the student side, but from what do I want these students to get, right? So it's a leadership program. We are looking to invest in SLPs and audiologists who will be leaders in their fields, in their professions, and in the association. So what are the mentorship piece I have noticed comes in? So again, we talked about structured versus organic. During this week-long program at convention, we bring these students to meet other leaders in the association. We bring subject matter experts in. We bring MSLP alumni in. We bring STEP alumni in. We have them meet the president and the president-elect and the immediate past president. We help them connect with all these different leaders that they probably never would have done ever. I don't know when this would have happened for them. So we create that for them. They even meet people who are on different committees, boards, and councils. We set that up and, okay, this group of students, this is your kind of area of study. They have to do a presentation at the end of the week. Here's your area of study. You get to go to the Multicultural Issues Board. You guys get to go to the GAP Board, Governmental Affairs and Public Policy. So what I have watched just in my 2 years, it hasn't been long, and I've actually only done it 1 year, but what I've watched is the organicness of those mentorships. It's not a structured mentor leadership. It's not that kind of program. That's STEP. This is a leadership program where we are investing in them to become leaders. And within that, I have seen them meet. I have seen a subject matter expert come to, sit around a group of 6 or 7 students. They're having their conversations. It's done. Time is done. And there they are. They are still sitting
Still
there.
talking.
Card is getting exchanged. Text message. The phones are out. Oh my God, I'm working on a project at school and I would love to. Yep, come on, let's do it. We have reviewers come and help review our presentations, and you should just hear them come up to them. I would love to learn more about what you're working on. So it's these organic relationships that are happening. And I've even been, I guess, a recipient of it. I've gotten, a lot of my students calling me, emailing me, texting me over the year. Dr. Hamilton, quick question. So in my program, there was this. I'm like, okay, let's do this.
Yeah.
Let's do this. And so I think what it's getting right is creating the environment so that organic mentorship is happening.
Yeah, because it's only a week. So
Mhm.
that's a good point, right? Because we've
Yeah.
been talking about, longitudinal mentorship or,
Mhm.
but this is a week-long program, right?
This
And
is a week-long program at ASHA. Now, there are some kind of, we do there's a webinar last night, and there'll be, I think, maybe one more webinar before we get to convention. So there's times for them to, again, meet different people at ASHA and different leaders at ASHA. But the actual program is, 1 week long at convention. And it is really fascinating to watch who who clicks, who connects, and who stays. Again, I think either they're getting these wonderful, 1 hour conversation with a leader at ASHA that I never thought would happen, or they're exchanging email addresses, they're exchanging cards and phone numbers, and who knows what those relationships look like now.
Wow. Wow. So they are, I'm a Hamilton fan. You and the actual,
Oh, I was like, oh,
the musical. Yeah, no, not, well, yeah, you, but the musical. So I think
okay,
about
me too. It's fine.
You got very excited. The room, the room where it happens, where
Oh,
so,
yeah.
you're putting people in the room where it happens, and there is something that does happen when you do set others up. So I think there is something to be said in creating an environment where people can connect and feel safe, but also feel poured into. And so I wonder, for you, how can you, when you have those moments, and I know, I'm not sure if you've ever experienced this, where, you do a program, sometimes it's a vacation, and you're just lost in the sauce. You're like, this is great. When I leave here, like, you got the t-shirt, you got the hat, you got a stack of cards, right? And you're like, when I leave here, I've connected and I networked. But how can you make sure that that ongoing education and self-reflection is encouraged among both sides, the men? Because I've been there before, where I've been I've been a mentee, when I get all these cards and, oh my goodness, I'm so excited. Or I talk to a person, it's like, we're going to be best friends. We're going to do all the things. I'm going to get all of it from you. You're going to get, and then you leave and life happens, right? And all those goals that you have for your mentorship experience, for your mentor, your mentee. So how can you kind of keep that spark of ongoing education and self-reflection, to really make sure that you are approaching your mentorship relationship with cultural humility?
I think so. Are you asking from the mentee side? Are you asking from the
I'm
mentor
asking from
side?
both.
All
I
of
would love to
both?
know both. I would love to know both.
I think, okay, well, let's think mentor side. Again, there's that interesting power dynamic that will probably innately just be there, right? At some point, it might innately be there. It might, kind of level out at some point during the relationship. But in the beginning, it's kind of like the way it goes. So recognizing that and knowing that you might need to be the one to reach out, right? So recognizing, because the student or the mentee might feel, I don't want to, like you just said earlier, I don't want to bother. They're really busy. I don't want to do that. I don't. It was great meeting them, but they're not going to remember me. I don't know. So if the mentor is the one who reaches out, hey, just want to follow up with you. I am pretty busy, but let me know if there's any time you want to talk, and we can put something on our calendars together, and let's, get this rolling. I think establishing, again, it depends on the kind of relationship you want. You can either establish, like, we will meet first Tuesday of every month. We will have a conversation first Tuesday.
Yeah.
Then no one, that takes away the cognitive burden for anyone to remember anything. Or if it wants to be just as needed, I am here. Here's my cell phone number. Text me if you need me. I think different modalities of communication, this is what we do. We're SLPs. There's different modalities of communication, and sometimes the email might feel so formal. If that's the relationship you want, then you keep that formality, fine. But if you're looking for that mentee to feel a little bit more casual and comfortable with you, here's my cell, and you can text me when you need me. I may not always answer at first, but, I'm just letting you know. I always tell people, send me a nudge, because I got a 6-year-old and a dog, and life is just a lot. So I think from the mentor side, putting forth that effort, knowing that the student or the mentee may not want to do that out of fear of just, one, not getting a response, right? Out of fear of, not sure what to say, not, maybe they didn't remember me, all of that.
Yeah.
But from the other side, I'm actually, and this is tricky because it could be a personality thing too. I am of the mindset, I'm like, okay, I met them. Was the spark, what was the spark there? And then I feel some kind of energy and connection, and I really just want to like learn so much more from this person. If that passion and that strength is so strong, then I will reach out to them, right?
Yeah.
Knowing that the worst thing that's going to happen is they won't email me back. It's
Right.
probably the worst thing, right? If there's a connection at all, the worst thing might be they're not going to email me back. So that's what I'm going to think. And I'll say, you know what? Let me just go ahead. And if they email me back, that's great. That's awesome. Now I can hopefully, start the conversation. If they don't, then I got something great from them in that time and I can follow them that way. But I think just trying to ignite that first connection post the thrill that you talked about, post that, it's awesome.
Yeah.
I think that first, that first step is making that connection again, because now we're in a different context. Now we're away from the convention. We're away from the networking environment. We're away. So now it has to look a little different.
Nice. Yeah, I think those are very valid points. And I think the role that cultural humility plays in those, what's resonating with me that you're saying, is that culturally, when you hold someone to a certain esteem, we all have kind of these cultural definitions and cultural norms of what a mentee-mentor relationship is. And I think we don't even know it. Because as you're talking, I was thinking, well, as a mentor, in my culture, the student always kind of comes and humbles themselves and comes to the teacher, right? Like that's what it's supposed to be. You're supposed to be humble and, meek, and the mentee comes to the teacher and you're like, Sensei, please train me, show me the ways of the force, and that is almost a way to prove, right? That's how it's raised. Like that's how you show someone that you respect them. You take the initiative and you reach out. But that's just my culture. Hi. That's just I knew he was gonna pop up in here because he's my mentee. And so I think that, but on the other side, culturally, some people come from cultural backgrounds where you don't speak unless you are spoken to as a sign of respect, where don't take the initiative because that's seen as being overbearing and pushy and disrespectful. And so you don't push back. And so I love your point that, sometimes being, culturally humble in the mentorship relationship is taking that first step, because the other person might think that by hanging back, they're being respectful. And they might be waiting on you to kind of give them permission to engage. So what a great nugget. And I know I could talk to you about this forever.
But I like what you said too, and I'm thinking about this too. It's also, I think sometimes it's so hard to think 3 steps ahead, but that's what we do for many things. In those moments, I can't remember how you worded it, but I really loved it. In the high, right? When that initial meeting and you're like really excited. If you can even have the wherewithal, which would be difficult, mentor or mentee, this has been great, right?
Right.
How do you want to continue this? Because then maybe that gives the opportunity for whoever, the person, the mentor, to say, how would you like to continue this? Would you like me to follow up? Would you like to talk later? Would you like to follow up later? Like, it's hard to think about it in the moment, I think, but I'm hearing what you're saying. And I think instead of doing that, because I think this happens often too, I think sometimes it just ends up 2 people not doing anything then. And it was
not
great. And
knowing,
maybe it was
because
for the
nobody
moment.
knows, because nobody taught us, right? We learned a lot of things.
Exactly.
We
Right.
learned a lot of things in school, but one thing that's interesting is that I've always found it fascinating that we're a profession that we supervise folks and we mentor, but we never take a supervision and mentorship course. We never have any type of supervision and mentorship training, right? We learn how to give assessments, we learn how to do the treatment, we learn how to do the therapy, we learn how to do the research, but at any time, as a speech language pathologist, depending on where you live, you could be supervising an assistant or, in a supervisory position, but we don't have any formal training on supervision. And we don't have any formal training. There's not a class like you take a phase or you take child language. We don't take supervision and mentorship as a course, right? It's one of the 10,000 courses that we probably need added because we need to have a 50-year master's program. But
it's funny you say that. You're making me think, Treasure, about, so we're trying, we'll try and teach cultural competence with, being culturally responsive with assessments, even diagnosis and treatment. But we also far as I'm remembering, we don't always do this cross-cultural interaction.
Yeah.
Right? Like, so not the assessment when it comes to the standardized test, did I, mark them wrong when it was actually dialect? When it comes to treatment, what should I be treating? What should I not be treating? Because this was, culturally embedded response or
Right.
behavior or communication style. But when it comes to actually like the greeting, right?
Yeah.
The greeting in the waiting room,
Yeah.
right? When it comes to actually the conversation in the ethnographic interview,
Right.
right? But when it comes to those kind of conversations cross-culturally, which happens in mentoring, that is something that I think does not happen, does not get trained or taught. And I think it's something that is worthy of thinking about differently, right? Because I think we can think very clinically about it, as we talked about earlier, but I think there's ways to think about this conversation that happens cross-culturally, and cross-culturally, not just race, not just gender, all different cultural background differences.
The whole kaleidoscope.
Yes.
And so in our last minute, this is my final question I love to ask everyone is, what's on your bookshelf? What would you recommend we be reading more to learn more about this? Or what have you read that has really impacted your ideas on cultural humility, culturally responsive practice, and mentorship, or just anything, to be honest?
It's like, okay, well, those are 3 different answers. So
give me all of them.
I was like, so the book next to me, I thought you said that. So there is a book next to me, The 6 Types of Working Genius, A Better Way to Understand Your Gifts, Your Frustration, and Your Team. It's a great book. I think I gravitated towards it because I am someone who, okay, so remember I was a school-based speech language pathologist for 10 years in Brooklyn. And one of my sayings to anyone who would listen to me was, I've never met a child who wasn't smart. And that is the truth. I've never met a child who wasn't smart. It's just, what kind of smartness do you have, right?
Yeah.
Like how does that show up? So I am always about, I guess, to use words that I think we can all understand, I am a very strengths-based person, right?
Okay.
So I like to look at people's strengths and see how that works. I think this could go across, culturally. I think this could go across just who we are with, the way our brains work, learning style differences, communication style differences. So I think I gravitated towards this book, one, because of the role I'm in right now at ASHA, but also because I love for us to look at, okay, so I'm looking at you and I don't want to know what you don't do. I want to know what you do. Like, what do you do? I don't like to find out what people don't do, because usually when we say what someone's not doing, it's because we've compared them to a standard. And usually that's a standard that may not fit their cultural background, their identity. So if we compare them to that standard, we're going to always set them up for failure. So for me, whenever you're working with someone who has a different background, try to take a look at what they do, not what they're not doing.
I love that. I love that.
And
just thank you so much, Dr. Megan-Brette Hamilton. We appreciate your expertise, your research, your education, and the wealth of knowledge that you provided on this topic. Thank you, everyone, so much again for joining us for episode 5 of Culturally Speaking, Cultural Humility Through Mentorship. I'm your host, Dr. Treasure Williams-Wood, and we will see you next time.
Thank you for joining us for today's course. To complete the course, you must log into your account and complete the quiz and the survey. If you have indicated that you are part of the ASHA registry and entered both your ASHA number and a complete mailing address in your account profile prior to course completion, we will submit earned CEUs to ASHA. Please allow 1 to 2 months from the completion date for your CEUs to reflect on your ASHA transcript. Please note that if this information is missing, we cannot submit to ASHA on your behalf. Thanks again for joining us. We hope to see you next time. Each episode comes with an accompanying audio course on speechtherapypd.com. Available for a 0.1 ASHA CEU. And just for our listeners, get $20 off any subscription with promo code SLPLearn20. SpeechTherapyPD.com is run by SLPs for SLPs. They've got the largest library of ASHA CE eligible courses out there, and they're adding fresh content every week. Remember, use the code SLPLearn20 to get $20 off access to over 1,000 courses for an entire year. Head over to SpeechTherapyPD.com for more information and start earning CEs today. Thanks for tuning in to the SLP Learning Series. And don't forget, SpeechTherapyPD.com is your go-to for all things ASHA CEUs. Your positive reviews and support mean the world to us, and we'd love for you to drop us a quick review and hit that subscribe button.